The lack of health insurance is not just a personal matter, it touches the whole community.
When individuals don't have access to care, it's harder for them to hold down a job, it's harder for them to provide for their families, and that has an impact on all of us when members of our community aren't able to meet some of those basic needs.
Fayette County ranks as one of Georgia's most prosperous and healthy communities, yet 20% of residents are uninsured or underinsured. The opening of Fayette Care Clinic in 2006 was a community response, a free clinic staffed by more than 50 volunteer healthcare professionals and over 90 non-clinical and student volunteers.
We serve the uninsured residents of our county, and in-house we provide medical, dental, vision, physical therapy, dermatology, cardiology, patient education, and referral system to 6 other partners.
Last year, Fayette Care Clinic handled more than 1,700 patient visits and enrolled 400 new patients. Many had unmanaged chronic conditions like diabetes.
I knew how to check my blood sugar, but I didn't really know what to do if, say, it was 240 or 400, or I didn't know whether to take a shot, eat something, go walk, or I just didn't know. When I came here, they sent me to seminars and gave me literature and allowed me to talk to other people that were having the same difficulties as I was. She also provided me with an assistance program where I could get medications, insulin, test strips, syringes, things like that for my diabetes, which was very helpful and which is very costly.
For those who have lost jobs and benefits, the clinic makes all the difference until they're back on their feet.
Being a prostate cancer survivor, I have to have my PSA done every 6 months opposed to once a year, which is normal after about 50 years old. And like I said, here we are with no insurance, and then that was around the downturn of the economy. My business went belly up. My wife was the only one working at the time, and so now we can't afford it. She found Fayette Care Clinic, and what a blessing, you know what I mean? Came in here, we qualified for the services, and they've been taking care of us ever since. If the clinic wasn't here, I don't know what I'd do. I really don't know.
The clinic is really a lifesaver.
Last year, Fayette Care Clinic provided health services with a value of more than $4 million and did it on a budget of $250,000. That's the power of community united around a cause. Funding comes from grants and gifts, including United Way of Greater Atlanta.
United Way was actually the first grant that I received when I first got to Fayette Care Clinic, and it was for $25,000. It's amazing to me they've been there this entire time that we've been in business.
Healthcare partners and the services they contribute are essential in meeting all the needs of the clinic's patients. In addition, United Way planted the idea and provided funding for Fayette Care Clinic to lead a sophisticated collaboration with other local agencies to address patient needs in a holistic way.
It's not just about healthcare, it's about mental health as well. We also talk about things like resume building, nutrition. We talk about budgets, how to do a budget, but then they may need clothes. So we all work as a formal approach, share the data, and we track the data here at Fayette Care Clinic.
And I think United Way's stance of coming in to kind of partner with those organizations and help them partner with each other, and that's really important because I think there's a lot of the pieces in this community already, but I think United Way can really play a vital role in helping connect all those pieces.
Respecting the dignity of every patient is a fundamental value of Fayette Care Clinic and a huge reason behind its success.
When I came to the clinic, I was mainly looking for just a helping hand because me and so many others were laid off. Not a handout or anything. And so that's exactly what they helped me with, was helping me maintain and control my diabetes.
It takes a lot for you to walk into somewhere and be at a free clinic when you used to have money in your pocket. These people should be treated better than you and I when we walk in our physician's office and hand them a card. And that's what I expect here. And that's what we all strive for.
The need for more access to health care that's being met by Fayette Care Clinic exists in every community of our region. And every community has people of vision and resolve who want to forge solutions. United Way of Greater Atlanta stands ready to help, to encourage, to make the connections, to be the catalyst. Because being Greater Atlanta means being healthy. All of us.